Hello all. Thank you so much for making time this afternoon for this really important topic. I know anyone who's worked in our sector will have had some intersection with this issue. So I'm sure we'll be hearing some really interesting strategies and ways of thinking about what we can all do. I'm Mandy Charman, Senior Manager here at the Centre for Excellence in Child and Family Welfare. And on behalf of the Outcome Practice and Evidence team and the Centre, I warmly welcome you to this session. I'd like to begin by acknowledging the traditional owners of the land we're meeting on today and pay my respects to elders past and present. I extend that respect to all Aboriginal and Torres Strait Islander people here with us. First Nations communities have modelled collective care, accountability and child-centred decision-making for tens of thousands of years, and their traditions continue to guide the work we're all part of. So before we start, I'll just say a few words about OPEN, Outcome Practice and Evidence Network, run by the Centre. OPEN is a sector-led network connecting practice and lived experience knowledge, research and evaluation to strengthen practice and improve outcomes for children, young people and families. We work to translate evidence into practice, support sector evaluation and learning, and create spaces like this one where practitioners, researchers, young people and leaders can collectively explore what's working and where we need to push further into ongoing improvements, sharing from each other's knowledge in a way that brings policy, research and practice experience and frontline engagement together. It is a unique forum or opportunity or platform, if you like, because it does bring our government colleagues shaping policy, our researchers creating new evidence about what works, and our frontline workers living that evidence and learning themselves what works on the ground together in a truly unique sort of way. So today's session is part of our Family Violence, Sexual Violence Knowledge project, delivered in partnership with No to Violence, Safe and Equal and SASVIC. We'll share a link to the Knowledge Hub and hopefully you'll find a lot of other materials on that portal where you'll find the research, resources and practical tools relevant for anyone who is working to support children, young people and families experiencing family violence. The research we're discussing today is based on a qualitative study published in Children Australia. We'll also put a link to Children Australia. The Centre publishes Children Australia, so it's a free online resource for writers and their audiences, such as yourselves. The research today, though, has explored how residential care practitioners understand, identify and respond to child sexual exploitation and what helps or hinders effective action. Our presenters will unpack key findings from their research, offering practical reflections on workforce capability, training effectiveness, and the systemic conditions that are shaping outcomes for children and young people. While the research we'll hear about today was undertaken in Queensland, we know that children and young people in residential care settings across Australia face heightened vulnerability to child sexual exploitation. As such, this is an important topic for us all and an upsetting one. So be aware of how you're feeling yourself, I suppose, in working through this discussion. In Victoria, both DFF through the Child Exploitation Strategy and the Centre's own Residential Care Learning and Development Strategy are working in partnership to deliver workforce development opportunities to improve confidence and skills in identifying and responding to child sexual abuse, sexual exploitation, different from abuse, within out-of-home care. If you'd like to find out more about the Centre's CSE training, reach out to the email provided in the chat. Our presenters today will offer practical reflections on workforce capability, training effectiveness, and the responses of practitioners that they've engaged with through their research project. Okay, So now on to our lovely presenters. Thank you so much for making the time to be here with us to share your research. Welcome Conrad Townsend. Conrad is the Principal Advisor, Child Sexual Exploitation at Project Paradigm, a national program aimed at increasing the capacity of professionals and communities across Australia to better understand and respond to child sexual exploitation. Welcome also Emma Rees. Emma is an experienced social work practitioner, early career researcher, and educator with expertise in child protection, child sexual abuse and exploitation. She's a sessional academic at QUT School of Public Health and Social Work and a project officer at Project Paradigm.
That was a lovely introduction. What a fantastic welcome and start as well. So we'd like to acknowledge that we're on Gubbi Gubbi Kabi Kabi lands today on the Sunshine Coast. I have the privilege of being able to live here, and it's important for us to recognise their continuing connection to the lands and waters across this region. And I feel very advantaged to be able to live in such an amazing place. And we'd like to pay respects to elders past, present and future, and also more broadly across the country as well. It's probably helpful to give a very brief background on who Project Paradigm is, and actually also IFYS. IFYS stands for Integrated Family and Youth Service. Project Paradigm very much has its inception really 46 years ago when IFYS was first established. It actually started out as a youth crisis shelter here on the Sunshine Coast in Mooloolaba. And most of the work at the time was actually with young people who were sleeping rough and engaged in what was inappropriately referred to at the time as opportunistic prostitution or child prostitution. Thankfully, we don't use that language anymore, and language is certainly an important thing that we're continually having to work quite hard on. In those days, we were one of only 5 agencies across Queensland that was funded to provide what was known as detached outreach or detached youth work. That's something that actually we're starting to see a little bit of a comeback in Australia on, and it's hugely needed because it actually fills a gap for young people who don't engage necessarily in service delivery or service access in conventional ways. Today, we have a footprint that runs in from the Gold Coast in the south, all the way up to the Tablelands in the north, and out west to the Darling Downs. We have services that range from domestic and family violence support, family support services, emergency relief, homelessness support, and we also have a fairly significant number of young people in out-of-home care who access services that we run. Project Paradigm is the only nationally focused program that the organisation runs, and we divide our time very much across training, education, resource development and advocacy. So we have a very simple vision, and that is to have a national community that's committed to the protection of children and young people from CSE through collaboration, advocacy and support. So opportunities like we have today, so collaboration with the centre to be able to present research that we've been involved in, and also knowledge dissemination, really. So very simple, sounds very simple. Our work seems to get more and more challenging all the time, especially with the advent of AI and technology and all of those additional things. So that's a very abridged version of our background and what we do. But if you do want more information on what we do, you will see our website link at the end, and please feel free to reach out to us. I'm going to hand you over to Emma now, and she's going to get us kicked off really into CSE and the research.
Thanks, Conrad. So I'm going to start with the definition, and I'm sure that there's many people with us who already would be able to explain what child sexual exploitation means to them. But we feel that a definition is a starting point. And it's been well noted in research that's occurred since the late 1990s that it's really important to have a shared starting point. As Conrad said before, we've used really inappropriate language to describe this in the past, such as opportunistic prostitution. And when we use that language and we don't have a shared definition, then we run the risk of blaming children for abuse that they're subjected to and not really focusing on the perpetrators who are the root cause of the issue. The Royal Commission again in 2017 in recommendation 12.15 suggested that we need a nationwide definition so that we can all measure the same data and we're all starting from the same sort of understanding point. There isn't a national definition even today, and I'm sure we've selected this one from the Australian Institute of Health and Welfare because we think it's a really good definition that incorporates so many different elements of what child sexual exploitation is and how it impacts children and young people. It's actually very difficult to find this, but we have given a reference towards it. So we're starting from the point of saying that child sexual exploitation is a form of child sexual abuse that occurs when an individual or group attempts to or succeeds in coercing, manipulating or deceiving a child into contact or non-contact sexual acts, A, in exchange for something including but not limited to money, gifts or accommodation, or less tangible goods such as affection or status, and or B, for the financial advantage, increased status or other reward for the person or people exploiting the child. And it's really important to note this last bit, that a child over the legal age of consent may have been sexually exploited even if the sexual act appears consensual. And this point is something that we constantly find that we're pushing back on, particularly around children who are 15, 16 or 17. So we want to acknowledge that child sexual exploitation is complicated. You can see we need quite a long definition to source our starting point. But we just want to highlight these other additional complicating factors. And that is that the most significant indicator of CSE is when children go missing from home. And sadly, many young people are going missing from home in Australia. And that's not just children in out-of-home care. That is from all different sectors of our community. But yes, children in care, they are highly represented in the group of missing children. So 53% of missing episodes involve children, and 40% of children going missing from care in Victoria are exploited, or they were found to be in 2021. And we know that here in Queensland, every night there's approximately 800 children who are missing from state care. So obviously this is a very vulnerable group of children and young people. We also acknowledge that 4 out of 10 young people who are subjected to CSE have a criminal history, and they're more likely to struggle with substance abuse, so that vulnerability is then heightened. We know that after experiencing CSE, children often face long-term psychological trauma, but we know that many children who are subjected to it also experience that same trauma. Again, children afterwards often face difficulties in forming healthy relationships, but they may also beforehand. And CSE is underreported in ethnic minority communities. So I guess what we're just wanting to acknowledge is that any child can be sexually exploited and be vulnerable to that. But we know that children living in residential care are targeted by perpetrators because of the unique and combined vulnerabilities they experience. So just talking a bit about the DICE project. So DICE was put in place across 3 states, Victoria, New South Wales and Queensland. And it was designed to think about how we disrupt child sexual exploitation. The aim was to consider the implementation of 3 elements of enhanced CSE response. So it was very future looking. So thinking about trauma-informed disruptive policing, multi-agency working, and attention to children and young people going missing from residential and home-based statutory care. So we acknowledge that the work we've done in Queensland might represent our context, and it might be very different to what's happening in the other states. But we still feel that there are really valued learnings that we can share. Because each part of the project was embedded within policy and practice in each state. So we are speaking to Queensland, and I might keep referring to that as we go because we know things are different elsewhere. So in Queensland, we had our unique objectives and methods. We didn't have the same partnerships that other states had with statutory agencies. IFYS was our linkage partner. And so we had to make sure that our research was not only responsive to the DICE project, but it also met the needs of the organisation. And at that time, we felt it would be really helpful to understand from the experiences of IFYS frontline practitioners and the facilitators and inhibitors to the disruption of child sexual exploitation, and how multi-agency collaboration was kind of working or not within the state. So we had 2 phases. We started with qualitative interviews with 8 frontline practitioners. All of those participants had been trained they'd had specialist training in CSE. But the second phase was much broader, and we had a survey for the whole organisation because we wanted to understand knowledge gaps and attitudes that kind of represented more of the general community. So there were different levels of training and self-reported satisfaction with training within that group. So it was a broader and much more mixed group of participants. So here are some of our findings. Training was kind of front and center. We acknowledged that a lot of the participants in the qualitative, they had all experienced training, and they were all very, they had gained so much in terms of their practice and their knowledge and their awareness from training. They realised that it improved their understanding of the nature and dynamics of child sexual exploitation. They were able to identify warning signs and indicators, and it had overcome the socio-cultural tendency to blame victims. So there was a real reflective moment where all of the participants would reflect back and think about children or young people they'd worked with in the past, which they now saw very differently. Now they understood the definition of CSE and how that impacted on children and young people. They could look back and think, oh, well, we treated this child in this way, but actually they were probably a victim of child sexual exploitation. So this first comment we have from Olivia, she's referring to a young person whose behaviours had previously been conceptualised as promiscuous. That was kind of how they described the child's behaviour. And when she mentioned a boyfriend, they just dismissed it. But then with the training, with the learning that was happening within the team, this is what she commented. She said, we did start to see a significant increase in her substance use and being absent quite often. Some of the comments that were being made by this young person indicated that this was an older male. So their awareness of indicators and warning signs meant that they didn't just categorise the behaviour as promiscuity, but they actually thought, hang on, there's something else going on underneath the surface, and they dug a bit deeper and unpacked it. And this comment from Rebecca, so she was comparing the experiences of children and young people in 3 different regions. And she was describing organised gangs who would set themselves up in a certain area and then start to expand. And it was very localised. So the youth workers could identify the streets and the suburbs where they might find their children and young people when they went missing. So they noted that they'd had experiences where children in one programme were brought into a child sexual exploitation gang, provided drugs, transported to 2 other areas, into motels, to then be used as a sex toy. So obviously it's quite difficult for the frontline practitioners when they're finding the children in their care experiencing these horrific experiences. And so then they're gathering this information and they're quite excited to be trained and identify what's going on for children and young people. But they find that when they then inform Queensland Police, they sometimes have limited support, or the response just isn't there for them to able to safeguard the children. So the really powerful message that was coming across is that practitioners can get really good at identifying CSE, but then getting the action they need to actually protect their children is much more difficult. And they did acknowledge that the pre-service and in-service training that they had related to CSE was limited or inconsistent. So only 25% had pre-service training. So that's like in your generic higher education disciplines. 55.5% received in-service training, but overall 85% would like further training. So even though they're getting a really good, robust level of knowledge that's enabling them to identify CSE, they still have an appetite for more learning, particularly around what they can then do when they've identified it. So then we talked about the barriers to effective system responses. So 40.6% of the participants identified that effective system responses were due to challenges in effective interagency working with police. Again, we acknowledge we're talking about Queensland Police here, and there might be different processes and procedures in other states, but this is the experience of the youth workers here. And 27.5% of participants identified barriers to effective system responses due to challenges in cooperative relationships with the Department for Child Safety, whose name is probably now different to that. So there were individual factors and there were systemic factors that were the themes that were coming out in the research. So as individual factors, there were knowledge gaps relating to child sexual exploitation, judgmental sociocultural attitudes and victim blaming. So when you think about here, we have a very strong discourse here around youth crime, and we've seen earlier how young people not only are sexually exploited, but get drawn into criminal activity and drug use and things like that. And so this can really affect the victim blaming. And so Rebecca noted that police and child safety officers have verbally expressed the kind of attitude that these children are asking for it. They put themselves in the environment. If they just stayed away, they could get drugs elsewhere, or if they just didn't do drugs, they wouldn't need to be there. And so that it feels like a lot of it is probably where they kind of asked for it. So on an individual level, when we don't have the shared definitions and understanding, this is kind of the impact in practice. And then the systemic factors included resource limitations. So when there's young people missing often, police often seem to get quite fatigued with that, and they don't have the resources to be able to respond as much maybe as they would like to or they can. Same for child safety, carrying very high caseloads of young people. When this young person is experiencing CSE, they're probably going to be demanding a lot of time and attention, which potentially child safety officers just aren't able to meet those needs. And then the design and delivery of residential care. We've just had a commission of inquiry into child safety with a big focus on the design and delivery of residential care. And Jackie was one of the participants who said that one staff member trying to manage 4 young people and meeting each and every one of their needs can be quite stressful. So not only is it really difficult to give the young people a baseline of good, solid care and stability, but if one of them is sexually exploited and then the police or the other agencies aren't responsive, then they're essentially just holding this child and young person and seeing their sexual exploitation continue without any disruption. And I think that's really difficult for our residential care workers. So what enables better collaboration? 46.6% of the participants felt that multi-agency working with police was really important to have effective responses. It's effective, and there were some initiatives where this was working. So when child safety officers and police have a shared and accurate understanding of child sexual exploitation, they empathise with sexually exploited children, and they are resourced to respond, or they make it work. Even if they don't have the resources, they'll stretch themselves to be able to respond to that child or young person. So essentially, this is the importance of shared training. So we don't just want to train in silos, we actually want to do joined up training so that we can also design joined up responses as well. We found that child safety policies and procedures and police legislative powers in Queensland, they need to be specifically tailored to trauma-informed CSE responses. So you can't use the tools that you already have and adjust them to CSE because of the complications and the complexities of CSE. We need those unique policies, procedures and legislative powers. But there are localised initiatives and professional relationships between agencies that do help. So a lot of the participants would describe situations where they had really strong relationships with police, say, and so if uniformed officers weren't responding, then they could appeal to the relationships they had in the network, and they could get some improved leverage and some improved responses. And so I'm going to pass back to Conrad. He's going to contextualise that knowledge and describe how it impacts on what's seen in residential care and IFYS.
Thanks, Emma. So drawing on really some of the complexities and the intersectionality that we see when we're looking at CSE for young people in residential care, it's useful to look at case studies. So we've pulled together a de-identified case study here from a particular location in Queensland. And what we actually analysed data from critical incident reports across a 3-month period, essentially. It might have been just over 3 months. So we looked at 3 IFYS residential care programs, and we identified over that period of time there'd been 303 critical incident reports. Now, what was of note was that 146 of those incidents were related to CSE. They involved 10 young people across those 3 programs. And those young people came from a diverse range of backgrounds. We had certain additional needs in those cohorts of young people. So things like developmental delay, varying degrees of learning disabilities and cognitive impairments. And we noted that across those incidents, there were 17 adults in contact with those young people. So adults of concern who we believed and the evidence suggested were actually exploiting these young people. So when we extrapolate from that some of those intersecting issues, we found 20 concerning addresses where activities seemed to continually occur. It was clear that we had adults within the cohort of adults that we were concerned about who were actually directing the young people into criminal activity, so essentially criminally exploiting them. And that would be everything from petty theft right through to car theft and doing fuel drive-offs. And of course, this is where, teasing out some of what Emma was talking about before, the reality of that intersectionality, the fact that you've got, in the research, around 40% of young people who are exploited also having a criminal history, you start to see this quite profound intersection quite a lot. 49 of the incidents involved drugs of some sort, so cannabis, MDMA, methamphetamine, and heroin use. And so one of the intersections that we commonly see are young people who are essentially groomed. Part of the grooming and control process is to essentially give them drugs, create compliance and dependency, and that then really essentially compounds that power and control differential, making it a lot harder for young people to actually step away if they want to. So this is kind of a snapshot, and what was useful about this was actually looking at the period of time. So that's quite a short period of time. If we think 3 months or just over 3 months, that many incidents across such a small number of young people, a small number of residential programs. Now that's just in one location, and we've got a whole range of case studies that we've seen in other locations dotted around other parts of Queensland. But it's useful for really kind of talking to the need for multi-agency responses, because where you have such intersectionality, no single agency or no single player can actually do this on their own. And another case study we wanted to share was this one here. And this really highlights that we almost have a two-tier system in play, where children in out-of-home care are concerned versus children that would grow up in a typical family home. So back early in 2024, I was actually consulting on a case elsewhere in the state, and coincidentally, at the same time, a 12-year-old girl went missing from the Sunshine Coast, from a typical family home. She'd actually told her brother that she was going to a local park nearby, which wasn't unusual, and it was actually a nearby park. But what materialised over the course of 3 days that she was missing was that she'd been groomed online by an adult male and persuaded to meet up with him. She was found 2 days later, 35 kilometres away. Now, what struck me was the sheer contrast between how that case was handled and the case of another missing girl who I was actually consulting on the case for at the same time. So the difference, we had Amber Alerts going out for the 12-year-old who was missing. There were search parties. I literally drove past SES teams out looking across scrubland, trying to find this young person. We had drones out with speakers on, broadcasting messages in case she was hiding or had run away intentionally. There were pre-recorded messages that were being basically broadcast on loop. There was CCTV footage being scrutinised right across the region, looking for this child. And contrast that with the 13-year-old who goes missing from residential care who had also been groomed online and then reported missing by staff from the residential unit. And what was so frustrating and I guess really challenging was the fact that the youth workers had to really fight hard to get the police that they were dealing with in a localized context to actually take it seriously, because this young person had a history of going missing. And so she was actually seen as problematic. And essentially, there was literally a response where staff were actually told, she'll turn up when she gets hungry. She's done it before. And then it really fell to support workers to actually have to start digging and doing really the work themselves to try and locate this child. When they actually managed to locate her, it turned out she was 120 kilometres away. Not a small distance when you're talking about a 13-year-old. So she'd actually been essentially trafficked. When she'd been located, the support workers asked police to actually do a welfare check, and they'd actually had quite a good dialogue with police who were engaged in Police Link. And it was agreed that a welfare check needed to happen. Staff couldn't get away to do that welfare check because of the distance and the fact that they actually had other young people in the residential unit to look out for. And the request was actually refused by police at a local level. Again, because this was being seen as a child who was essentially wasting their time. And we're paraphrasing here in what we've got written on the slide. They essentially said that there were more important matters for them to deal with at the time. And what was so sad about this case is when this child returned to placement, one of the first things she asked her youth worker to do was take her to Big W to get a pregnancy test because she thought she might be pregnant, and then disclosed that she'd actually been sexually abused and raped while she'd been away from her placement over the preceding couple of days. And so I guess what this highlights is where we see such a difference in how children and young people in the system get treated by the system versus children and young people who are outside of that system, but then get treated by the system. Now, obviously, we could generalize a little bit here because we know we're going to see differences even in those cohorts of young people who are essentially not in out-of-home care. But this is a theme that we commonly see. It's not unusual. And the reality is what it highlights is really when you have good, coherent multi-agency working, you actually get far better results. We actually saw that ironically with the girl who was 12 who went missing, because the amount of resourcing and effort that went into finding her actually paid off. She was located, and it resulted in someone actually getting arrested. So we kind of highlight, I guess, that if you don't take a multi-agency response, you're actually creating a much narrower window of opportunity. So we recognised this back in 2017 in the Sunshine Coast region, and we supported the establishment back in those days of a multi-agency working group, essentially a working group where we had key agencies and stakeholders pulled together who could contribute to disruption and intervention. And some of the core focuses really of that working group in those days was to raise awareness of CSE for agencies involved with children and families, creating a shared framework of consistent practice to understand and manage risk effectively, effective information sharing, and that is a major issue in general. In my career, it's probably been one of the biggest inhibitors to getting good outcomes for children and young people who are at risk. And finally, collaborative planning for the purpose of intervention, disruption, safety and support. And we've actually had some very, very good results from taking this approach. Now, to give you a bit of a snapshot, from January to November last year, across 12 months of meetings, we had a total of 22 young people referred in to the working group on the Sunshine Coast. The median age was 14. And that's probably typical of what we would see. We generally see that 13 to 16 age range appear. And so this is, I guess, an example of what can happen from that kind of multi-agency context. So this is another case study. We had a 15-year-old child referred into the working group by a local non-government agency. They were actually providing outreach, and they'd identified some of these key indicators of CSE. And what was noted in the background of the young person is they'd recently experienced a breakdown in family relationships, which compounded vulnerability factors. There was demonstrated low self-esteem where the young person was concerned, and the outreach workers noted that the young person was becoming more and more isolated from their traditional peers and social networks. And it was one of those peers, one of her friends, who actually disclosed that the young person had met an adult online. And the young person had also disclosed that their friend was meeting up with this adult online regularly at different hotels in different locations. Now, it's worth pointing out, prior to the working group meeting, this young person had no contact with statutory agencies. So she wasn't actually known to the child protection system. So the outcome from being able to actually have a young person referred into a multi-agency working group was the police were able to actually engage their youth co-responder team to actually shift focus to this young person and what was going on. Child safety, the department were able to actually go and talk to the young person to try and actually understand a bit more of what was going on. The Department of Health, actually, they agreed to initiate a referral in for additional support for the young person around mental health and emotional support issues. The outreach service that was already working with the young person continued to provide support to the child, but they also provided support to the family as well. And in that process, they were able to gather more information and really, I guess, disseminate that across the working group members in a way that was going to contribute to disruption and intervention. And then we made contact with the hotels that had been identified through the information gleaned and provided them with additional resources and information on CSE. So where you have young people turning up with adults and things don't feel right and this looks strange, what they could do and the kind of signs that they could be looking out for. So the result of this collaboration was that we had a child who became more connected with their peers, actually also more connected with family, and more connected with adults, trusted adults who could actually be a support to her. She disconnected from the adult male. He was obviously on the radar of police then, and police actually pursued that. And, you know, if we think about long-term life trajectory and aspirations, we had a young person then that was in a position to be able to actually focus on her life, unaffected by adults who didn't have her best interests at heart. So she actually started a traineeship. So she was able to actually start really, I guess, starting to fulfill some of that potential there. So that's an example really of what it can look like when you have multi-agency best practice applied. And the interesting thing is, while there may be formal frameworks in certain jurisdictions, in certain states, that's not a consistent thing across the country. And in Queensland, it was very much, this approach has very much been driven by NGOs who have recognised the issue and wanted to do something to disrupt and prevent. Back over to you, Emma.
Oh, well, we're moving into a bit of a collaborative moment because we're going to discuss the best practice continuum.
Yes.
So I guess we sort of recognise that none of us probably are there yet in terms of designing and implementing a really robust response that means that children are protected. You know, as I said before, often children are identified, but sometimes it is difficult to get to that case study outcome. So we've got 3 elements within our best practice continuum, which is recognition, which is really addressing the hidden nature of sexual exploitation. And we need to disrupt it by pulling the rug out and undermining the myths and the stereotypes about the children who are sexually exploited and the ways that they've got into that kind of situation where they're so vulnerable. We need to think about the sophisticated grooming and exchange elements that act as barriers to disclosure. And also, if you think about a child who's also been dragged into crime, how are they going to disclose? Because they're going to have to disclose criminal behaviour as well. And when you've got a very hardline political policy that is going to lock you up if you're involved in crime, then that is another massive barrier to disclosure. The understanding and characterisation of CSE helps inform data collection. We don't really know what the prevalence is for CSE in Queensland or in Australia. The Australian Child Maltreatment Study gives you some kind of indication through their work around types of perpetrators, but we don't really know how many children are experiencing this. But what we do know is that when children do experience it, it might be a small number of children, but they're experiencing a lot of harm, a lot of different crimes committed against them by a relatively small number of adults. So if we really targeted those adults, we could have potentially a big impact. So consistent language and definitions, but actually a commitment to wanting to tackle child sexual exploitation is really important.
Yeah.
Is there anything?
No, I think you covered off on that very well, Emma. So yeah, I mean, essentially, certainly in our experience and in my career, 20+ years working in this space, undertaking direct work with young people specific to the lens of CSE is really crucial. And I think this is one of the things that really comes through when you have a good understanding of what CSE looks like, and certainly how young people experience coercive control, the power and control dynamics. We tend to find that we get better outcomes, but it is really critical. And that means essentially we need to be better informed as a community. So thinking certainly the professional community, but professional development. And when we look at what we need to know across the spectrum of intersecting issues that occur with child exploitation, that might mean we need to actually upskill and develop professionally in different domains to really be trauma informed and really understand. And another area that often gets overlooked is education, where young people are concerned, but actually their families as well. When we look at the fact that probably one of the biggest gaps we tend to see, and certainly the research speaks to this, is that knowledge gap for parents and carers. So upskilling parents and carers to be able to understand and identify, but then also understanding what they can do in their role. And also the role of advocacy. It's very easy for us to become siloed in how we advocate or even just complain about things. But actually, it's important that we use our voices as professionals within our regions, within our broader jurisdictional context, to actually advocate for systemic change and improvements. There is always room to improve.
Good. And finally, staying connected. So we recognise that meeting unmet need is more preventative than education. We need to take an interest in what young people are doing online and offline, because there is a lot of emphasis on child exploitation online, but often not the same emphasis of offline. They're seen as two distinct things, and really they're also intermeshed as well. If someone's being groomed online, there's a high chance that someone's going to try and meet that child and harm them offline. But again, we don't have the data to know what's going on in the community. We know a lot about what's going on online and how big that issue is, but we don't know so much about what's happening offline. We don't really know who's accessing our children, why they're doing it, and how they're doing it, and how we can stop that. And so being available and accessible, and that collaboration and information sharing through concepts of a community of practice. As Conrad just said, we're stronger together. So if lots of different organisations are seeing the same issues, if we can pull together and work together and advocate together, we might get bigger shifts.
Great. And that is pretty much all we've got time for, I think. So I'm just going to stop sharing and back over to you, Mandy.
Oh, thank you. So much food for thought. And frankly, I imagine everyone sitting here with just this horror feeling for these poor young people and the disproportionately different way our society responds to them, despite sort of great movement and improvement in understanding. We have had a range of sort of observations, many thank yous, many that it seems like a no-brainer, but sadly it's always the workers on the ground who have the least systematic clout that are carrying the load with no resources and support. So leapfrogging from that, and you've provided a lovely sort of overarching structural framework, which I'm really looking forward to having a more detailed look at. But if you were to crystallise what were the one or two things our practitioners in our audience who are at the front line of doing this could do as the most immediate sort of risk mitigation sort of approaches, what would you propose would have the most meaningful change if you're at that level, I suppose? That's a hard question, so you don't need to keep strictly to it.
Do you want the non-controversial answer to that? Or okay, what I sometimes tongue-in-cheek say when we deliver training, I tell people to be awkward, difficult, and noisy. And because what I always try and loop back to is the fact that everything about a child's life is controlled by adults. Whether that's the children who are in a loving home, or whether that's children who are actually being abused, where their lives are controlled by perpetrators. The bottom line is everything about their life is controlled by adults. So if we're not out a voice for them, if we're not being noisy for them, and we're not being difficult on their behalf and speaking up, then we won't actually get ultimately the best outcome for them. So that's my I guess my view on it and my approach. I know that doesn't necessarily always work for everyone, but having been working in this space for so long, it is the squeaky wheel that often ends up getting listened to.
And just to add to that, maybe also sort of think about within your sphere of influence if you can step out of that at all. So are there any opportunities for you to support research? Like how can we discover prevalence without just relying on universities? We really need that connection between practice and academia. And so if you're in a practice role, contact some academics and say, this is what's happening on the ground. Are you in a position to be able to design some research or perhaps get involved in research yourself?
Yeah.
Your comment there, Conrad, about if you're not taking up the space and advocating, because often too teenagers, any teenager doesn't want parents to advocate, particularly, or adults, particularly in a context where they feel they're totally defined by them. But if you're not taking up their space, there will be other adults who will, and they're the adults that's effectively what you're saying. You're ceding that ground for others to step in.
Yeah, absolutely. Look, I can tell you now, I can't think of very many cases of CSC that I've worked with where it's actually been focused on connection. So the young person has been seeking connection because there's an unmet need there. And of course, to your point, other people will fill that void if that's, that comes back to what Emma said earlier around, meeting unmet need is actually far more effective than education. It's not to say education is not important for a child, but the reality is it is about the resilience within that young person's life. And that means the resilience within their network, their social networks, their family networks. So connection is hugely important.
Yeah, absolutely. We have had a really interesting comment about the role of the public and raising public awareness, and wondering if you wanted to comment on that. So not just other aspects of the service system, but the basic outrage that these are children experiencing this from the public, and how can this message be spread more broadly in our media sort of landscape? What would your comments on that be?
I think for me, a lot of it comes back to that consistent language and definitions. Over the years, Conrad and I have worked a long time together on this, and over the years, we've seen situations which are CSE, but they're not described as that. So we had a situation where they found a body in a barrel, and it became known it was a 16-year-old child who'd been killed, but she was described as being in a relationship with the perpetrator, and it was a clear case what we saw of CSE. And so many times in the media, you just get this misterming, misdescribing relationships between people, equalising children, that whole problem with consent. So definitely the media needs to be more clear on what they're reporting and using consistent language around that as well.
Yeah, and it's really interesting because even within the media, I think there's a disconnect within the media. So you will have media report on a story in one location, and then they'll report on a story in another location, but they might characterize them completely differently. I wrote an angry letter to the editor of the Courier Mail a few years ago now about this issue, because they published on their front page 2 stories of child sexual abuse. One was correctly characterized as child sexual abuse, and the other was actually interpreted as a relationship. And yet it was very clear. And actually the other one had a very clear power and control differential, because there was a teacher who was actually grooming and sexually abusing the child. So I think, the National Office for Child Safety has published guidelines on this. But I definitely think there should be, and this is probably a piece for advocacy, there should be a national minimum standard that has to be adhered to when it comes to stories that relate to this kind of content and material. And
yeah, just something else that occurred to me, I think, how do we build that outrage? I mean, as I said before, it's very difficult when we've got these other discourses, political discourses, and in the media demonizing these children and young people. So for me, I think that we counteract that with the voices of lived experience. And if you're a practitioner, and if you can amplify the stories and experiences of your young people, we've got a community which is quite fatigued, I think, by not really knowing what they can do. They don't know where to direct their outrage. And if we can actually centre the experiences and voices of people with lived experience, then we can challenge those big discourses that say these children are just bad children and they kind of deserve everything. Some of the Facebook comments that you see around children who commit crime are really disgraceful. So why can't we build that same outrage against the perpetrators of causing so much harm to vulnerable children?
Yeah. I suppose it does occur to me that we have, as you've pointed out, we've both got practice, we've got people on the ground, and we've got system intersections here. And I'm just interested in your research, whether there were successful coordinated responses that you have sort of become aware of, and what would you say were some of the critical success factors for that, to support that?
I think it's a really difficult one, because I think that you would hope that you have, that there's quite an easy pathway of youth worker identifies CSE, mobilises other agencies, perpetrator is locked up, no longer harming that child or other children, and that child is safe. Unfortunately, that wasn't the situation in the research, but we were discussing this before, and I think even though that wasn't the case, there had been some of those localised initiatives that at least had shifted things, even as a sort of a ripple. So, okay, we didn't get to that ideal place where perpetrator is gone and child is safe, but we did along the way have some movement in terms of perceptions and understanding. And like your case studies show, that it is possible to do enough work with a child. But I do really think that if we could put more into targeting perpetrators, we could have so much more impact.
Yeah, and I think the first person really to talk about this on, I guess, the international stage was a woman called Dr. Sarah Swan back in the mid-90s, and she highlighted in her research, having worked with hundreds of children who'd been sexually exploited, she highlighted that the tendency is to focus on the child as the problem. And then we tend to overlook the adults in this equation, the perpetrators. And what she noted is that there were much higher success rates for disrupting and preventing harm when agencies actually, or multi-agency responses, focused on the young person in a supportive, trauma-informed way, but then the perpetrators from a disruption perspective. So doing it in parallel, so essentially a parallel process. And I think what we tend to find is we have almost an all or nothing approach, where we want the evidence to get to a conviction, but unless we've got the evidence to build a case, nothing happens. And so there tends to be less focus on disruption. And so we tend to find that a lot of the discourse then that focuses on the child or young person tends to be frustrated. So it's not necessarily trauma-informed, and it's not necessarily always helpful. And certainly in my experience, where we've seen probably the greatest level of results are when you actually have that trauma-informed understanding, the understanding of what's going on, but then everybody coming together and going, well, you can do this in your domain, and you can do that in your domain over there, and really playing to people's strengths. We've had some cases recently that we've been consulting on elsewhere in the state, where we've seen some really, really good relational work between police and frontline staff that has actually improved the quality of information sharing, but also improved the quality of response. But that's localized, and that's been very much based on people building relationships at a local level.
Yeah. Which really does put a lot of pressure on the local responses of those individuals who are already under quite a lot of pressure, rather than a system rolled out, enduring sort of systemic response. Thank you so much again, Emma and Conrad. And I'm hoping that this has given everyone a lot of food for thought. Please reach out if this is an area that you want more content on, because this is sort of our purpose, Open's purpose, to bring research, policy and practitioners and frontline staff together. So please do that, and have a lovely afternoon, and perhaps a little bit of self-care after such a serious topic. Thank you very much.
Thank you.
Thank you.